clarify for us, is ketamine legal? Let's just
Ketamine's
start
legal. So
there.
ketamine is a medication. It's a medication that any physician can prescribe. So it's just as legal as amoxicillin. Any physician who graduates medical school or residency, when you have a license to prescribe, it is a legal medication. So I dealt with a lot of pain patients, and at the time I didn't personally do ketamine, but we would refer out for ketamine as a kind of end treatment when patients weren't responsive to and do ketamine infusions, and their results were amazing. Some results were, I mean, I want to say 100% of the people got benefit. Some people got benefit for weeks, and some people got benefit for months after just 2 weeks of infusions with ketamine.
Okay, thank you for clarifying for that because
Yes.
I feel like some people get a little nervous about that whole thing. All right, so let's talk a little bit about the data around ketamine and migraine. So ketamine can be used in a lot of different ways for migraine. You can use it as an intranasal spray. You can use it as an IV infusion. People often go into the hospital for days at a time for that. Or you can use it as an intramuscular injection, which is like
Yep.
once a day, you get a little poke and then maybe you come back and do that treatment multiple times. So
Yeah.
here's,
Can we back up for a second,
yeah,
actually? Because I think there needs to be a bridge here. So ketamine is used every day, all day in anesthesia, but it's used a lot in specifically pediatric anesthesia. I want to say almost 100% of pediatric anesthesiologists use ketamine, and we use it a little bit in adults. But that being said, I just want to point out that it is used all the time and it is very safe. And in anesthesia realms, it's much higher doses than we're talking about in psychedelic or migraine treatment or even pain treatment realms. And so I just want to say that we would not use it in pediatric anesthesia, obviously, if it wasn't very safe, because we want to keep our children the most safe of all. So it is a very safe medicine, and it is more new that it is used in the psychedelic realm, but also there's been a lot of poor media press, I think even in the past year, with like Matthew Perry dying of ketamine. I don't think personally he died of ketamine. He was on 10 other different
yeah,
medications that can cause a
yeah.
lot of problems. And so there's, I think stars using ketamine and people use ketamine for fun, but, people do a lot of stupid things, in my opinion, for fun. That's going to kill you. So ketamine is extremely safe as a medicine, and especially even more safe in the doses that we use it. So this is not a new medicine, is all I'm saying.
Yeah, yeah, really good point. And I love that distinction you're making about anesthetic doses versus sub-anesthetic doses. If you do a Google search on this at all, you'll run into that. And I want to really clarify that the benefit comes at those sub-anesthetic doses. It's the lower doses that actually give people benefits. So if you go in for a surgery and you get a huge dose of ketamine for that, that actually might not help you at all. It's the lower doses that stimulate neuroplasticity, growth of new neurons, new synaptic connections between existing neurons, and that's where the magic is for ketamine. Yeah.
It really is the magic. So going back to what you're saying, there's many forms of ketamine now. You could take it orally, you could take it intranasally, you can do like an intramuscular injection, kind of like a B12 shot, or you can do it IV.
Yeah.
Yeah, go ahead.
Well, here's the data on migraine, and I'd be curious to know, what your knowledge base is with this too. But so there are studies of using intranasal lidocaine, just a nasal spray like Zavspret or any other migraine medication, and people take it multiple times a day. It does tend to help. These are very small studies, though. There are also
Mhm.
very small studies of using a continuous ketamine infusion in the hospital for several days, of course, with the hope being that you'll induce some sort of a permanent change that then persists and you have, fewer headaches forever as a result of that infusion. That does not happen, but it does last a good 4 to 6 weeks, which is fair. But for spending 3 days in the hospital, I don't think
Right.
that's going to be terribly practical for most people.
It's $100,000 price tag or something.
Oh, seriously, yeah. When the medicine is like 50 cents, right?
Yeah.
Okay, so then I think the most promising way to use this drug is as an intramuscular injection because you can have a dose, it wears off within half hour or an hour. It's enough to induce neuroplasticity and not so much that, it's like an anesthetic dose or anything like that. So I think that's where the real promise of this drug is. And so
Yes.
there aren't great studies. There's like one study of like 9 people, that hardly counts, of using ketamine in this way for people with migraine. But remember that when we do studies on people with migraine, we are lumping all of the root causes of migraine together. So we are
Yes.
looking at people who have troubles with their mitochondria, with energy. We're looking at people who have nutrient problems, maybe from leaky gut, gluten or dairy intolerance. We're grouping all of them in there too. Now, the people who are really theoretically going to benefit from ketamine are the ones who have neurotransmitter issues, right? Suboptimal serotonin pathways. For those of you who've had your serotonin genetics done, 5-HTT-LPR, TPH2, suboptimal dopamine genetics, DRD2, COMT, suboptimal BDNF genetics, because
Mm.
brain derived neurotrophic factor is like miracle grow for the brain. So
And
these
it's directly affected by ketamine, actually.
Yes, let's talk about that. So I just want to say that I think part of the reason these initial studies on ketamine and migraine have not been all that encouraging is that they're lumping everybody together. But when you do more of a subset analysis and say, okay, we know that the same genes that cause migraine also cause anxiety and depression. So what's the effect of ketamine on anxiety and depression? Now that's where the interesting stuff is. I want to show you guys an article. Um, Here it is. So, real world depression, anxiety, and safety outcomes of IM ketamine treatment, a retrospective descriptive cohort study. Basically, what they did here, they took over 400 people who had depression and anxiety, gave them injections of ketamine, anywhere between 1 and 50 injections. Average number was 4 injections. And even with just 4 injections on average, the improvement was 38% for depression, 50% for anxiety, with good p values for both of those. So I think this is pretty exciting because it helps us figure out who's most likely to benefit. So for people who are watching this, if you're thinking, gosh, should I go try this or not? If you know your genetics, or if you have a history of anxiety or depression, you may be one of the people who's more likely to benefit. Now, let's circle back to what you were saying about BDNF. And can you tell me a little bit about how ketamine is working in the brain and what it does with regards to BDNF?
All of the other psychedelics that I'm aware of bind to serotonin. And so serotonin,
Hmm.
as we, I believe, know, like, is kind of like this happy neurotransmitter and is this uplifter. And so when we have serotonin, we feel better. Um, so I always describe it like fruit. If someone comes to you, like, and you made this wonderful fruit salad, but someone comes to your house and they're like, "Oh, I've had fruit before. I don't like it," and you're like, "Oh my gosh, but try my like chocolate covered strawberries." Well, maybe they had a banana and apple, or maybe they had a fruit salad with a banana and apple and orange, but they've never had chocolate covered strawberries, and it's very different. And so that's like when someone tells me they've tried a psychedelic and it didn't work for them. Well, that's nice, but like they all are different. So just because they fall all under the umbrella of psychedelics, they all have very different flavors.